In 2019, there were 2,064 cases of dengue and 3 deaths. In 2020, there were 3,356 cases of dengue and 10 deaths. And last year, in 2021, there were 12,186 cases of dengue and 32 deaths, all reported in Maharashtra alone. The prevalence of dengue and other vector-borne diseases in Mumbai disproportionately impacts those living in low-income settlements and bastis in higher numbers because of poor sanitation and close living quarters. Civic authorities are keen to tackle this problem. However, a lack of reliable information on breeding spots, limited awareness about mosquito breeding, and how to prevent such breeding impacts disease control efforts. The Choo Machhar public health campaign aims to demonstrate how civic action among youth can lead to the prevention of vector-borne diseases in Mumbai.
Through the campaign, young residents of bastis were trained and encouraged to report mosquito breeding grounds and hotspots through WhatsApp. This data was then passed on to pest control departments in each ward to ensure timely interventions. These trainings also included guiding them on how to leverage their networks within their community to identify and prevent mosquito breeding spots within homes through behavior change communication.
Densely populated areas are often difficult for civic authorities to reach and provide mosquito prevention interventions such as fogging. In these cases, it is imperative for citizens to work alongside corporators and the BMC machinery to address such challenges for health and well-being of their families.
The campaign ran from April to August 2022. In these 5 months, 3 trainings were conducted with young students between the ages of 16 and 21. The pilot program was conducted in 4 of the risk-prone administrative wards of Mumbai. In the first training, the students were introduced to the concept of vector-borne diseases and their effect on society. They were taught to identify and report breeding spots through a WhatsApp chatbot that was specifically created for the campaign. They were also given kits with the necessary collaterals needed to carry out the program. The workshops were designed specifically using the principles of experiential learning. Each training session employed a mix of activities: exercises, group discussions, role-playing games, skits, audio-visual learning tools, all of this to get the point across to the participants. The response from the participants was very encouraging. They responded with great enthusiasm to the material as well as the methodology.
After the first training, the volunteers used the knowledge and tools supplied to them within their areas of residence and carried out fieldwork. We tracked their progress virtually and through regular communications via calls and messages. The second training given to them was on using social media for social good. They were taught about using social media to effectively communicate and advocate for causes, including the Choo Machhar program.
After the social media trainings, the volunteers carried out their fieldwork over 8 to 10 weeks. They visited the homes in their communities and passed on information about preventing home breeding of dengue mosquitoes. They also used the WhatsApp chatbot to report potentially dangerous public hotspots. The final training was on leadership and skill development, where they were taught how they could carry forward learnings from this program to other forms of civic action. They were introduced to the concepts of rights and duties and how they can facilitate access to justice for their community and continue to be active citizens.
Youth volunteers were at the crux of this project, and so we had obviously always expected that we'd learn a lot. But I think for me, one of the most significant learnings was that we can't take them as a homogeneous group. We worked with 16 to 18 year olds in junior colleges. We worked with undergrads, and we worked with slightly older kids across different cohorts. But what was interesting is that there's a difference in what their expectations are, what their engagement levels are, what their understanding of, say, something like social media is. And that gap is, say, almost as little as 2 years. So 16 to 18-year-olds were thinking and behaving differently to the 18 to 20, 21-year-olds, which is very interesting because as we work with youth more and more, one has to customize. We cannot look at them as a large homogeneous group. But superseding all of that was their enthusiasm. I think it was really heartening to see that they wanted to understand and learn more. And what we thought may be a slightly dry subject something like mosquito-borne diseases, what young person would really want to spend time on this? But it was, despite all of that, I think to see that 15 to 20% of the cohort was fully engaged with the project, not only met their targets but exceeded it. That was really heartening to see.
Throughout the program, we got a very enthusiastic response from the BMC. We worked quite closely with the insecticide officer and his entire team, along with the pest control officers at the ward level who supported us in identifying risk-prone areas using past data and helped us with ensuring that our training material was accurate. They also worked very hard to ensure that the public hotspots reported by our volunteers were addressed and the appropriate action was taken. The encouragement from the community, the volunteers, our partner organizations, and the local authorities have all come together to bring about the success of the Chhu Machhar pilot campaign.